Hello everyone. As you all know that in this channel we create a lot of informative content around facial paralysis and Bell's palsy. So here I am again with a new video on this topic of facial paralysis. But what exactly it is? Well, we are going to understand what's the difference between Bell's palsy and a Lyme's disease induced facial paralysis. As you all know, facial paralysis is a condition where your face gets paralyzed, but there are multiple reasons to it. One of the commonest one is Bell's palsy. But apart from Bell's palsy, there are other conditions as well that can give you similar symptoms. For example, Ramsay syndrome, Lyme's disease, stroke, Guillain-Barré syndrome, etc. So, what exactly is Lyme disease and how different this Lyme disease is from Bell's palsy? We are going to learn that in this video so that you can understand whether your facial paralysis is a Bell's palsy or else something else. Let's get started. Friends, facial paralysis is a condition where your face, especially one side of the facial muscles, the muscles which are responsible for your communication, your expressions, will get paralyzed. This majorly will happen due to damage to your 7th cranial nerve, which is called as facial nerve. Our face have got many tiny muscles that help you to blink, to smile and make those micro expressions that help you communicate in your day-to-day life. This muscles gets command from this facial nerve. And whenever there will be an infection, inflammation or damage to this facial nerve, the commands will stop coming to your facial muscle and your face will get paralyzed. As I mentioned, the most common reason for facial paralysis is Bell's palsy. This usually happens suddenly. Like you wake up in one morning and you will observe that one side of your face is completely paralyzed and your face will not move properly. But you will also observe that as you gradually get better with the help of your medications, your recovery will also start happening. Bell's palsy is majorly due to a viral infection or inflammation on the nerve, and most of the time, one side of the face is only affected. The good news is the recovery timeline of Bell's palsy is far more better and faster compared to other facial paralysis conditions like Lyme's disease, Ramsay syndrome, etc. So, what is Lyme's disease? Lyme's disease starts with a tick bite, a tiny black-legged tick. When bites you, at that time you develop Lyme's disease because they carry Lyme germs with themselves. Weeks later, some people will develop rashes, ear pain, facial pain, headaches, joint pain and facial paralysis. The difference here, both sides of the face can get affected at the same time, and there are associated symptoms that will be absolutely absent in Bell's palsy case. This will be tiredness, having fever or getting bull-eyed red rashes on your face. If we look about how this Bell's palsy will look different from the Lyme's disease, well, in Bell's palsy, the symptoms will be all of a sudden. For example, you were all fine and all of a sudden your face will get paralyzed. Versus in Lyme's disease, there will be a gradual progression of facial paralysis. It will often come after a tick bite, sometimes even after weeks of tick bite. It will be mostly on both sides of the face, rarely on one side of the face too. At the same time, there will be other symptoms as well, which will be absolutely absent in Bell's palsy case. What about the difference between the treatment of Bell's palsy and Lyme's disease? Well, Bell's palsy is an inflammatory or infectious condition related to virus. That's where corticosteroids is the key treatment line here. Steroid medication needs to be given in the first 72 hours to get rid of that inflammation that's developed on the nerve to help a patient to recover from it. For Bell's palsy, your doctor might give you some corticosteroids to reduce your swelling. They will suggest you eye drops, eye taping and gentle facial massages and practices like facial exercises. Most of the time, people recover out of this fully. Whereas when it comes to Lyme's disease, the key medication here is antibiotic medication. Doctors will suggest you antibiotics to fight the Lyme germs. With treatment, people also recover from this Lyme disease, but this particular condition takes a little longer compared to Bell's palsy recovery. But it's super important to catch the diagnosis of Lyme disease early so that it doesn't cause other health problems like joint pain and heart issues, which are probably likely to happen if this condition is left untreated. So remember, facial paralysis can come from different causes. Both Bell's palsy and Lyme's disease usually get better over a period of time. Bell's palsy can get better faster compared to Lyme disease. Bell's palsy will require corticosteroid and sometimes antiviral medication, whereas Lyme disease will require antibiotic as the core treatment. And if you ever find tick in your body, inform and remove it as soon as possible and start proper treatment immediately to prevent all of these complications. This was a small video to help you understand the difference between Bell's palsy and Lyme's disease. When it comes to rehabilitation part for Lyme's disease induced facial paralysis or Bell's palsy induced facial paralysis, it's almost the same. It all depends on what are the facial muscles that have been involved, at what stage these facial muscles completely paralyzed, partially paralyzed, whatever, and the treatment line will be determined according to that. So it's highly important to take professional help when you suffer from these kind of conditions. I hope this video was informative for you. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. On that note, I'll end this video here and I'll see you in another video. Thank you.